All right, Dr. Jeremy, good morning.
Good morning.
We'll give it just a second here and we're going to get out onto live and give people a chance to hop on.
Sounds good. I didn't ask you, can they see me?
They can see you. Yep.
Fantastic.
And they can hear you.
All right.
We are live. We're just going to give it one sec here. Okay. All right, we're just going to do a final check of sound, make sure everything is looking good, sounding good, and then we'll get started with Dr. Jeremy. Just want to make sure that our friends have been able to hop on. Okay. Looks like we're having some sound trouble. Okay. Okay, we'll work on the sound. All right, test, test, test. Okay, sounds like we're good. Sorry about that, everybody. We will kick it off. All right, well, good morning. My name's Brian Seigan, and I am the co-founder and CEO of The Exercise Coach. The Exercise Coach is an industry-leading personal training business that helps people get the results that matter most to them with no more than 2 20-minute workouts per week. And we offer our data-driven coaching in both one-on-one and semi-private personal training formats in small, clean, private exercise suites in more than 80 locations around the US and 25 sites in Japan. And today, I'm hosting another episode of Ask the Exercise Coach on Facebook Live with my guest today, Doctor of Physical Therapy, Jeremy Bourgeois. Welcome, Jeremy.
Thanks for having me.
Jeremy is a former professor in the physical therapy department at the University of Texas Medical Branch in Galveston, Texas, and is currently the clinical director at Vitalico Active Aging Clinics in Houston, Texas. And Jeremy is passionate about the benefits of strengthening for whole body health. And he focuses in his practice on muscular strengthening as physical medicine. And so I asked Jeremy to come on today and help people understand why muscle is so central to one's quality of life from a clinician's perspective. So thank you so much, Jeremy, for taking the time to come on today. I'm glad to have you here.
Thanks for having me. I'm glad to be here.
You bet. How you and your family doing? You've got one little one at home, right?
We've got one little one at home and one on the way, so we're doing well.
All right. Well, glad to hear that.
Yeah.
Well, Jeremy, just a little bit more about you, just to kick things off. Let's start with why did you get into a healing profession like physical therapy? Share a little bit with our listeners about your why.
That's a great question. I remember answering this exact question in my residency interview, and I later found out that the entire panel cried. So I'm going to try and keep it a little bit less emotional. But I grew up with just having a host of neurologic and physical ailments in my extended family, my grandparents, my aunts and uncles, and didn't really know about physical therapy. Was really more into the sports world, and kind of then found out about physical therapy and how it tied to sports, and then later found out how it tied to rehabilitation and other physical ailments. And that just led me down this path of really tying and mirroring everything that I was passionate about from a family perspective, and then also just personal interest in sports and whatnot. And then just kind of molded in, or just kind of evolved into this passion for just really utilizing the aspect of physical medicine and strengthening and exercise in and of itself as a means of not only improving physical performance in sports, but also affecting the livelihood and the quality of life for individuals that reminded me much of my family members.
Gotcha. Cool. So it's sort of, it sounds like there's a neat intersection of things that you're passionate about that you get to apply in your career, which is got to be pretty energizing.
Absolutely.
And just to help our listeners understand, could you define what physical medicine is really all about?
Sure. Physical medicine, I like to think of it in the sense of like, when people ask about, well, you're a doctor, or well, I'm a doctor of physical therapy. And there is a difference in that. And while, a medicinal doctor may prescribe medicine, we are prescribing physical intervention. And that can come through various different means, whether that be just manipulation of the body passively through the use of modalities, or the physical therapists themselves utilizing their hands, or the use of manipulating the body through exercise. So basically what we're taking is what you have internally, what you have endogenously through the natural physiology of your body, and we're utilizing that to treat a specific condition or diagnosis.
Gotcha. That's a good explanation. And so you're the clinical director and a practicing physical therapist at Vitalico Active Aging Clinics. Help everybody understand what sort of the specialty of an active aging clinic is.
Sure. So the first thing I always tell people is we're not an anti-aging clinic. The whole point is for you to actually get older. I mean, that's the emphasis is though how you do that, the quality of what that looks like. What does that journey look like for our patients and clients? And so when we talk about active aging, it's really more on the adjective and not the quality of how you are aging, in the sense of looking ahead and going, okay, what are the things that we can expect to come, or that may come, and how do we prevent those if we can, or how do we mitigate their impact on the individual, and then assessing if they've already started to experience some impacts of the aging process. How do we start to minimize, or if we can eliminate those impacts?
Gotcha. And let's see. So I lost my train of thought, Dr. Jeremy.
Yeah.
As a doctor of physical therapy specializing in active aging, then I guess from your perspective, what do you see as the biggest threat to people aging well, the biggest threat to people, their quality of life as they age?
Sure. That's a good question. And had you asked me that probably 3, 4, 5 years ago, I probably would have given you maybe a different answer. There's a lot of degenerative changes that we kind of have grown accustomed to, in a sense, in that we've kind of almost accepted them as the norm now for the aging process. And there's a lot of recent evidence and research that points to other means of kind of why those degenerative changes occur, and they kind of all centralize in one real key concept, and that is sarcopenia and the loss of muscle mass and muscle strength and the reduction of physical performance as we age. So it's widely accepted that, hey, we want to stay physically active as we age. There's still a lot of questions on, okay, how's the best way to do that? What's the most impactful way for me to do that, given whatever conditions or diagnoses that I may already have, depending on where they are in the spectrum of aging, but also just disability. Undoubtedly, I would say that regardless of where someone is in that spectrum, as we age, the most impactful condition, or I guess influence on how their aging goes, is really dependent on how well they maintain their muscle mass as they start the aging process.
Wow. Well, that sure resonates with me, and probably to some of the folks listening today. And I think it makes for it's going to make for an interesting conversation here going forward. So just for people that have just hopped on here in the last minute, we're speaking today with Dr. Jeremy Bourgeois, who's a doctor of physical therapy and the clinical director at Vitalico Active Aging Clinics. And one thing that's interesting about Vitalico is, at the Exercise Coach, we use a connected strength technology called Exerbotics. And in the realm of fitness, you really will only find Exerbotics connected strength technology at the Exercise Coach. It's a very exclusive offering. Then Exerbotics also does work in the clinical realm as well. So like in physical therapy clinics where Dr. Jeremy works, and you actually have the opportunity to utilize Exerbotics technology at your work in Vitalico. Is that right?
That is absolutely correct. We love having it. It's a great tool.
So we might actually talk a little bit about that as well. How, kind of your perspective on Exerbotics in your clinical work. So you say that the quality of one's muscle health as they age, and sarcopenia, the loss of muscle, is really central to one's quality of life as they age. Why is sarcopenia such a threat? Why is the loss of muscle such a threat to people as they age?
That's really a multifaceted question in the sense, because muscle in and of itself, we tend to think of muscle as really, as on the younger end, we tend to think of muscle more as a performance metric, more of an aesthetic metric. But on the other end of the aging process, as most of us get past high school and college sports, it really becomes more about the ability to just move and maintain a quality of life so that we can enjoy really just the things of daily life that bring us joy. But also it ties it is a critical component to several other systemic health metrics, including cardiorespiratory health, your metabolic health, your endocrine health. There's a lot of other systemic health other systems of health that are really impacted by our ability to not only move, but also just the physiologic impact that muscle has on the body.
Gotcha.
So it's really multifaceted.
And so as a physical therapist, are you seeing and treating conditions in all these various areas? So you mentioned metabolic, endocrine. Obviously there's orthopedic conditions I imagine you treat as well. Could you help us understand sort of just some of the conditions that you treat in these different areas with this focus on muscle conditioning, on strengthening?
Sure. Just to take that, I guess, system by system, from a metabolic perspective, there's several different metabolic syndromes and disorders out there, diabetes being the most common. Diabetes in and of itself comes with a whole host of presentation characteristics that would apply to the majority of our patients, or I should say several of our patients. There are several different characteristics with which we are addressing when it comes to addressing their muscle health. We know that when we talk about diabetes, we're exercise is the number one means of managing a type 2 diabetes. And so, but also there comes into the obesity tends to be something that's tied with diabetes as well. And so then we started looking into, okay, well, if exercise is the best way to treat this metabolic condition, but you have someone who can't exercise due to pain or due to just intolerance because of other characteristics that kind of come into play with diabetes, as far such as obesity or lack of, I guess, functional tolerance for movement. It really kind of all plays together, because even though we are treating, say, pain, orthopedic pain or whatnot, we're actually at the end of this treating their metabolic condition, diabetes, which is the thing that's preventing them from doing something else. And so,
I see.
From an orthopedic perspective, we're treating OA. It's primarily, I guess, one of the major orthopedic issues that affects us as we age. And OA, when I say OA, I mean osteoarthritis.
Okay. Very prevalent.
Yes, very prevalent. Osteoarthritis would be something that's really more of affects your load-bearing joints. So your inability to tolerate load through that joint is going to impact your ability to exercise. Well, and if you can't exercise, and you can't manage your cardiac health or your respiratory health or even your metabolic health potentially. And so then we're starting to see, like, okay, well, one condition and one system can impact the ability to exercise, but that also impacts another system.
Wow. This is an interesting picture that you're painting. So as it's sort of this cycle that occurs when somebody ages, and it kind of has to be, it sounds like it has to be kind of unwound, and multiple aspects have to be addressed, almost one to get to another. So as we age, we lose muscle. This impacts the way our body functions, the way our joints work. We experience pain. That pain prevents us from exercising. Not exercising leads to more muscle loss. This eventually leads to metabolic deconditioning and diseases like type 2 diabetes. And if we're going to treat that endocrine issue, the diabetes, we have to find a way to unlock one's ability to exercise. And so you, in a lot of cases, have to treat joint pain dysfunction to be able to get at, eventually, the endocrine system. So it's really a very kind of complex, multifaceted thing. But at the heart of it, it sounds like you're saying, and I don't want to put words in your mouth, but it sounds like you're saying to effectively address all these things, you're using muscle strengthening really at the core of your practice.
Right. And you said it really well, in the sense that it sounds really complicated, and you can really get lost in kind of the web of how all of these things kind of play together. But simplistically, yes, we have to take those things into account. But if we look at the common denominator across all of these different systems, one of those common denominators really goes back to, how do you move? Are you able to move? Well, what moves you? It's your muscles, let alone the metabolic impact that just muscle contraction has, the hormones that are released, the impact that it has on the cardiorespiratory system, the ability for blood flow. All of those things are taken into account, absolutely. And then also, just if you're looking at it purely at an orthopedic perspective, if you offload the joints, you have to load something else. Well, the one tissue that should be loaded is your muscles. And so there is this interconnected web, and they all seem to zero in to have on one particular tissue, that being your muscle, and your ability to really impact all of them by emphasizing just your overall muscle health.
Gotcha. And I want to be clear about something. So we've talked a little bit about pain and injury, and that is squarely within your purview. That's squarely within the scope of what you do as a physical therapist. That's different than what we do in the fitness realm. Even though there's this commonality, we're focused on how do we optimally load muscle tissue to serve as a stimulus to trigger the body to get better, and really all the systems of the body to get better. That is what we do at the Exercise Coach, right? It's this safe, effective, efficient approach to muscle strengthening. We say all the time, not because we want to turn anybody into a bodybuilder, but because stronger muscles mean better systems of the body. It helps all the systems of the body get better. What we don't do at the Exercise Coach as a fitness business is we don't diagnose anything. We don't treat pain or dysfunction or injuries like you do. So maybe just talk a little bit about maybe elaborate or clarify anything that I've said in terms of what's the difference between then personal training and physical therapy.
That's a really good question. And there's a lot of overlap. And if someone were to look at what we do, and PTs all the time get called personal trainers because we're labeled as PTs and personal trainers. So, I mean, even the acronyms are the same, but
sure.
There is a lot of overlap in kind of at least what we utilize in the sense of exercise is our modality and exercise is our tool. Where for physical therapists, obviously we're diagnosing musculoskeletal, neuromuscular, other specific conditions and diagnoses. And then we're utilizing exercise as a tool along with another host of tools, whether that be manual treatment, whether that be more passive treatments when necessary. So we're utilizing that from a medical perspective and with a medical intent to treat a specific diagnosis.
Okay.
Now the outcome, it leads to very similar outcomes of what you would expect with participating with a personal trainer in the sense of reduced pain, improved movement, things like that. But it's more of there's a movement out there that is more of referring to physical therapists as movement specialists in the sense of not only assessing specific conditions or diagnoses, but also assessing for how people move, not just how strong they are, but how do they utilize that strength? What's the pattern with which they move? How does that pattern of movement influence the different structures of the body? And so while we both utilize exercise as a particular modality, physical therapists use it more from a diagnostic perspective and then a more targeted interventional perspective. But we can have very similar results. We work very closely with personal trainers. Can't say enough, just the overall influence that they have on our practice in the sense of our ability to do that treatment, perform that service, and then hand them off to a personal trainer who we work closely with to say, hey, look, here's how they need to continue with exercise, and here's what you need to continue to monitor. And so while they overlap and they utilize the same tools, there's just different intents and purposes for how do they utilize that tool. They work along the same spectrum, providing very similar services.
That makes a lot of sense. So there's likely going to be some similar outcomes that we'll experience working with people as a personal trainer, but the intent is different. So when someone shows up, we're not going to say, we're never going to say that anything we do is designed to treat pain, for example. You can say that because you can bring to bear your diagnostic capabilities, your medical understanding and license, and other modalities as well to really make sure that you can effectively treat that pain. Whereas we're gonna instruct and supervise safe and effective exercise. And in a lot of cases, we know from research, people feel better, even
Absolutely.
as it relates to joint comfort, et cetera, low back pain, whatever it might be. That's a side benefit of safe, effective exercise.
Absolutely.
Makes sense. One thing that you made me think of as well, when you were talking about how this all works together, sort of the orthopedic limitations someone might have and the metabolic benefits they might need, you made me think about this term. People are hearing, I think, this term because of what we're going through right now as a country related to COVID-19, they're hearing this term comorbidity. And so I don't know, maybe it's a little bit different, maybe it's similar, but what I think I've heard that used by physical therapists before in the physical therapy realm. So help us understand what is a comorbidity really? And is the term kind of meaning the same thing when we're talking about that related to coronavirus outcomes and the way that you would use it in physical therapy?
Sure. So comorbidity just refers to just basically diagnosed disease processes or disorders, in the sense of like someone can have hypertension. Well, that's not normal. That is a disorder. And so someone can have diabetes, someone can have hypertension, someone can have hypercholesteremia, somebody can have CHF. So all of these things can be comorbidities. It just means basically a list of diagnoses that you have been diagnosed with. And so when we, in reference to like in light of kind of what we're going through now, in reference to like COVID-19, even though you may go be treated for COVID-19, the other comorbidities impact the treatment and the outcome for COVID-19. So that means that basically someone could have, when we talk about comorbidities, co meaning together, they are happening together, meaning that you may have hypertension with high blood pressure, you may have diabetes, you may have heart disease. All of those things would be a diagnosis that you currently have, and they don't go away, but we are primarily treating COVID-19 right now. And just those disease processes, or those diagnoses that are still there, but not the primary emphasis of treatment right now, can impact the outcome for this particular disease process, such as COVID-19. So when we talk about comorbidities, it just means what are the other things we have to take into account, and how are they going to, and when I say other things, what are the other diagnoses that come with this patient that we need to take into account, and how are they going to impact what it is we are actually treating? Gotcha.
That makes sense. So as it relates to COVID-19, it's they have COVID-19 and they might have another condition like a respiratory disorder, high blood pressure, they might be overweight, et cetera, et cetera. And in the work that you do, it sounds like then probably a lot of the people that you see, even though they come in for one reason maybe, or referred for one reason, they have these other things going. I mean, as an active aging clinic, if you're working with people that are in their 50s, 60s, 70s, how common is it for you to have to navigate comorbidities in treating someone?
That's pretty much the norm for us. One of our therapists will tell you that she doesn't really get the simple presentation. She tends to just get the complex presentation, which includes, I'm coming for, let's say, something like back pain or knee pain or hip pain. Well, yes, that's what we're treating, but there's other comorbidities that are going to come with that patient. And we typically get a host of, someone coming in for back pain and knee pain and hip pain. They've got pain in several areas. And so we're treating pain, and it's more orthopedic in nature for most cases. And then now we've got all this other host of comorbidities, in the sense that they have some form of cardiorespiratory disorder, or they've got a history of specific metabolic issues, or many other diagnoses that they could come along with. And that tends to be the case, in the sense of as we age, if we start collecting these things and we don't start dealing with them and checking them off and getting rid of them, some of them, the ones that we can, at least, they tend to just compound onto one another, making the situation more and more complex and more difficult to get to the root problem.
Gotcha. That makes sense. I think I've seen before that something like 50% of people over the age of 50 have multiple chronic health conditions. And when you get up over the age of 65, I think it's something like 80%. So pretty prevalent. Well, Jeremy, I want to make sure everybody understands that they've got a great opportunity to ask a doctor of physical therapy any questions that they might have and that you might be able to answer today. We do have one that came in here. So before we move on, I just want to mention that to everybody. Feel free to comment or question. And I've got one question. It's, can building muscle help with the immune system? Can it help build the immune system? And is that one way that it is medicine? Do you have any perspective on building muscle and the immune system?
Absolutely. From a general sense, as someone starts to lose muscle, we tend to kind of measure this on a spectrum of pro-inflammatory or anti-inflammatory. And so as you start to, muscle in and of itself has an anti-inflammatory effect. And so as you start to lose muscle, you lose that ability to produce that anti-inflammatory effect. And people tend to, as they start moving less, based on diet choices and just lack of physical activity in a more general sense, they tend to present with more pro-inflammatory like systems. And so there's just presence of specific biomarkers that are tend to be more pro-inflammatory. And when that occurs, then yeah, that's going to influence your overall immunologic response. And so undoubtedly, there is your muscle health not only will impact the health of your central nervous system and your musculoskeletal system, but it will definitively improve your immunologic health as well.
Great. Thanks for that. All right, guys, any other questions? Feel free to pop them in anytime and I'll try to pay attention and notice them. So Dr. Jeremy, maybe you could share with us now, like some stories, just maybe a success story or two of using muscle to treat medical conditions that people have, and what that leads to in terms of then improved quality of life and lifestyle outcomes. Would you mind sharing just just put it into a story for us? Give us
Sure.
give us one of your favorite examples in terms of a client, a patient in your case, success story.
Sure. So two people come to mind immediately. There's a lot of different stories I could share, honestly, but two stories come to mind in particular. One is a patient who we've treated who she came to us with a inflammatory disease that affected her blood vessels and the blood flow to her limbs. And when she came in, she painted this really grim picture of where she was before she came in, as far as just her overall health. It was just, she was really in a bad spot. And she had gone through her subacute treatment and everything. And when she came in, she was having a lot of balance issues. She had actually ended up with peripheral neuropathy, just a condition where basically it really impacted her ankles and her ability to move the muscles through her, just activate the muscles in her lower legs, really impacted her balance and her ability to walk normally. Of course, she had actually gained weight through the process, and she had not been able to move very well because of the balance issues. And so she had lost a lot of muscle mass and she was feeling really weak. And initially when she came in, I thought, well, okay, we're going down this route of really more of a compensatory path where we're probably going to end up down this route of dealing with bracing and things like that, really not necessarily looking towards recovering muscular function, but more so kind of how do we deal with what damage has been done. And nonetheless, we of course always want to try more of a recovery approach first. And so started doing a lot of lower extremity strengthening, core strengthening with her, balance training. And this is someone who was really even just nervous to walk out in their front yard and play with their dogs and whatnot. And she is actually this past fall was actually able to return to a part-time job, and someone who was able to now squat down and pick up her dog, and things where she still has the inflammatory issue, and she still has the peripheral neuropathy, but because she is strong enough elsewhere, primarily in her hips and through her core, her balance has dramatically improved. Her ability to move and to ambulate, to walk, has dramatically improved. Her gait speed, her gait endurance, all of that has dramatically improved to the point now where she can actually get back to doing something outside of the house and have a job.
Wow. And strength. So you're saying strength had the outcome of improved balance. Strengthening. Are you saying strengthening is connected with improving balance and even the way somebody walks?
Oh, absolutely. I mean, When we look at balance, I always tend to think of this in two different ways, in the sense that balance is definitely a sensory component. There's definitely a very complex sensory component to balance, in the sense of how you sense balance, how you perceive balance, different systems involved in alone in the sensory side alone. But there is always a motoric response to balance, in the sense that you can.
Is that like the guy that's half man, half motorcycle? You said
No,
motoric response.
not that kind of motoric response. When I see,
Okay, maybe rephrase it for us then, because I'm thinking half man, half motorcycle. So go ahead. Sorry.
no. So sensory being like your ability to perceive that you are falling off balance, right? And then motoric, what I mean by that is a response to that. How do you actively respond to that sense of falling off balance?
Okay.
And if you're off balance and you're trying to prevent a fall, you have to catch your balance, right? Well, how do you catch your balance aside from some outside surface or someone else coming in and rescuing you and helping you?
Got to contract muscle.
That's right. You have to contract muscle. Muscle is the only tissue that's going to actually be able to pull you back if you're falling backwards, to pull me forward, right? Your bone isn't going to be able to do that. Your organs aren't going to be able to do that. It's your muscles that actually pull you back. Even if you're not falling off balance, just the ability to maintain balance. If you ever watch someone's feet, you stick them on a piece of foam, their ankles and their feet start doing all this. Well, and that's just the minute contractions in their feet and their ankles, just pulling them and back and forth to make sure that they stay nice and centered. Now,
so even the balance training that you're doing is really at the heart of it. It has a muscular component. You're actually strengthening the muscles in the feet. That's Absolutely. Pretty cool. That's why we say strength changes everything at the Exercise Coach. So we've got some more questions coming in. Right. I'd love to get to that second success story here, but I want to make sure, let's go ahead and see if we can take some of these questions and in kind of 15 or 20 seconds, see if you can give some direction. So Julie says, so excited to do this when things are open again. So this might be for both of us. I'm not sure. I have major arthritis in both shoulders due to an injury. Sorry to hear that, Julie. And one shoulder needs to be totally replaced. I'm hoping that I can get some improvements with your systems and programs. So I'll go ahead and let you take that first, Dr. Jeremy. What do you think?
Well, sorry to hear that, Julie. First of all, going down a route of surgical intervention is a whole host of kind of like, I want to make sure I stay away from providing any kind of medical advice in the sense of saying like, okay, get surgery or don't get surgery or anything like that. What I would say is that specifically in a situation like this, I would say, okay, hey, you probably want to make sure you're getting evaluated by a physical therapist, in the sense that before you just jump into doing exercise in and of itself, especially if you've got a condition where there is enough damage that a surgeon has said, hey, look, we actually need to replace this joint as a whole. I would say, okay, hey, before you do just jump into exercise, make sure you get examined by a physical therapist in your area, so they can give you at least some guidance into how you can be successful in doing that. I would hate for somebody to jump in expecting the results and then go, oh, I hurt myself even worse. Because once you start introducing tissue damage and mechanical damage to a specific joint, there are specific things you really want to take into account in how you proceed with exercise and how you load through that joint. But that being said, if you haven't done a bout of rehabilitative exercise with a physical therapist, I would definitely encourage that. I am just personally and professionally on the side of, anytime we can avoid surgery, do that. Try to do anything and everything you can to avoid surgery if it doesn't require some life-altering or life-saving measures. And so I would say, go get examined, see if you can work with a physical therapist that can introduce you to a level of exercise that's appropriate for your condition. And then undoubtedly, if you are able to prevent surgery, great. I know the Exercise Coach has the means to tailor to where you are at, to adjust the amount of load, the range deficits that you may have. So I know they have those capabilities through the Exerbotics. And so that would be great. But I would definitely recommend getting some medical advice and kind of how you start the exercise regimen.
Thanks for that. Yeah, I was just gonna say that it's a great example. At the Exercise Coach, one of the things we're gonna do when we first meet someone is an initial consultation that will involve a health screen that we take people through, and we meet a lot of people that have physical limitations, conditions, and many of those will actually trigger us to ask for physician input. In some cases, we end up speaking with a physical therapist for input as well, and we want to make sure that this is an individual that has a medical provider that believes that they are ready for physical activity, for strengthening. And in many cases, these conditions have been conditions that have really turned into a fairly chronic situation that they've been living with for a long time. And we find clinicians are really willing to let them think it's a good idea for them to get into strengthening. I thought about something we do particularly at the Exercise Coach. You kind of nailed it when you talked about the range of motion and the way that we can limit and be really smart about that. We see a lot of really great strengthening benefits with people that come in that do have various types of arthritis. One of the things that we do is in those cases, now in a lot of cases, that's just one joint. This person,
Right.
maybe it's their knee or their knees or their shoulders, but they've got a whole lot of muscle in the body that we can utilize to stimulate whole body benefits.
That's right.
Without having to work around it. But where we do have to work around joint issues, we use a very limited range of motion for quality muscular loading through just a comfortable range of motion. We found it to be kind of a breakthrough. What do you think? If we can measure the load and do it through a limited comfortable range of motion, is this a good approach to get at somebody's muscles even though they have arthritis?
Absolutely. I mean, in our practice, we work very closely utilizing the Exerbotics equipment, and then also we've gotten several patients from you guys in the sense of those people who come in, and it's more of a, hey, before you start with the Exercise Coach, hey, go get screened, go see a medical professional, and they'll come in, and in many cases we'll actually say, okay, hey, well, here are some therapeutic exercises that we're going to start you on. But yes, absolutely, if it's appropriate, we want them to immediately start jumping into whole body exercise and experiencing the whole body exercise outcomes that will actually improve their pain and what they're experiencing from that particular joint, that injured joint. And so there's many times where we'll say, hey, yeah, we're going to treat your shoulder, but we're going to actually have you, if this is something you've been interested in, we would love for you to start with the Exercise Coach, because we know that, hey, look, this is going to be somewhere where we know that they're going to control what range you're going through, how much load you're going through. We can objectively see that report as far as what they've been doing. We can see exactly how far they've progressed and whether or not there's a pain threshold there. And so absolutely, while it may be appropriate to get some medical guidance for that particular joint, that may not prevent Julie from actually participating in whole body exercise outside of that shoulder or in conjunction with that shoulder.
I was going to say sometimes we have clients who are going through physical therapy and working with us even at the same time.
We have several clients that have done that, and so that's where the PT and the physical therapist and the personal trainer work collectively and really collaborate, utilizing the same modality and just making sure that they're understanding as far as what those restrictions and guidelines
you bet
guardrails should be.
Thanks for that, Jeremy. And Julie, good luck. And I hope that we can help you here in the near future. And Chris has a question. Why does muscle decrease so quickly when muscle isn't used? Question, use it or lose it? Even with a cold, for example, let alone more serious issues. Why does muscle decrease so quickly when it isn't used? Dr. Jeremy, I'll let you take that one.
That's a great one. Chris, that's a great question. As far as the pathophysiology, as far as like why we use muscle or why we lose muscle so quickly, there's a lot of, let's just say there's a lot of very specific reasons as to why you could lose muscle. And that process is not really definitively understood as far as, hey, this particular process is why we lose muscle so quickly. You can look at it from an energy perspective in the sense that, and this is kind of how I will present it to patients, in the sense that your body is always looking to conserve energy, and muscle requires a lot of energy in the sense of metabolic energy to maintain the tissue. And so if there's other things that you are fighting, or if there's other things that you are doing and you're not activating that muscle, your body doesn't, you haven't induced a level of stress that says, hey, look, this is something that you need to maintain. Your body will then start to dispose of that tissue as a means of draining the metabolic resources that it has available to it. We know that that's not what we wanted to do. That's actually the exact opposite of what we want to do. If we have a cold, as you mentioned, or some other disease process, at the end, during that process, we actually want our muscle there to help us. We want to be able to move more to actually facilitate recovery and facilitate immunologic response. And so, as far as why, there's a host of reasons out there, and I think when we get to a definitive answer as far as why you lose muscle for one specific disease process versus another, or whatnot, I think that answer is going to be multifaceted. I think the more important public education point is the sense that you are losing muscle if you are not stimulating it, in the sense that sarcopenia is, I've heard this COVID been given, I guess, the tagline of what is the tagline, in the sense that it gets everyone, it's, how do I say that? No one can escape, right? In the sense, but I guess some of us can't escape COVID, but I say that in the sense that sarcopenia is something that all of us will have to deal with. We always say that the only two certainties in life are death and taxes, right? Well, sarcopenia is also one. We should add it to death, taxes, and sarcopenia.
Wow. And just to be clear, again, for people hopping on, that's the age-related loss of muscle mass. So,
right.
So as people age, you cannot avoid the inevitability of muscle loss unless you do something to mitigate it.
And that's where you start getting into the caveats of sarcopenia, because there's actually a primary sarcopenia and then there's a secondary sarcopenia. And so from a primary perspective, yeah, it's something that none of us are really going to, it's something that we're all going to have to fight. That's probably a better way of saying it, in the sense that rather than it's something that we can't, that all of us will inevitably succumb to, it is something that we all have to fight. It is something that we all have to deal with. Secondary sarcopenia would be what Chris is referring to, in the sense that you lose muscle acutely after a short bout of inactivity, whether that be due to a respiratory illness, hospitalization, a fall, an injury, a surgery.
Yeah, it's such an important point, because you're going to what you go in with is going to determine what you come out with and the point that you get to during that illness. And as you kind of touched on, I mean, our body is diverting resources to fight that infection. Right. It's
right.
diverting, and it can't keep this muscle around and utilize all the energy necessary to keep the muscle around. So it actually is diverting its attention to fighting this disease, and it's essentially consuming that muscle as this reservoir, this backup to be able to fight the disease off. And so going in with a bigger reservoir means you've got more reinforcements, and hopefully you don't get to this threshold level that is really, really dangerous. But we've got to be thinking about that earlier in life, or we've got to be thinking about that before we experience this acute illness or acute injury, right? We want to be building as much muscle as we can so that we can fight the fight we need to fight down the road with that muscle. So such an important point to make. Looks like we're coming up here towards the end of our time together. So I've got one more question I'm going to let you take. See
Sure.
if you can just give a real quick answer. Have you ever worked with patients? This is from Mike. Have you ever worked with patients who have ataxia? You can just define ataxia for us. And then what are the best balance exercises that you would recommend for someone with ataxia?
Okay, we have worked with patients with ataxia. Ataxia is a movement disorder, typically associated with disruption in the function of a particular part of your brain called your cerebellum. And so, in the sense of ataxia, it's more of an inability to modulate muscular control, in the sense that where you may try to reach for gently to pick up something, you overshoot that, and then the response is to undershoot, come back and overshoot again the correction. And so it's typically in a general sense what ataxia is. And so when it comes to treating ataxia, we do work on balance. Yes, we do work on really a more proximal strength, in the sense. When I say proximal, I mean closer to the center of the body. So like think of your trunk, think of your hips, really working on stabilizing the core, the middle of your body. And then as we start strengthening there, start progressing outward. There's different types of ataxia, and so it depends on the ataxia that you're actually that someone is suffering from, how you would treat that. When it comes to specific balance exercises for ataxia, again, that's going to be dependent on the type of ataxia. It's going to be dependent on what's causing the ataxia. The main thing is just to prevent falls, obviously, and to stay moving as much as possible. And so that's where a physical therapist is going to come into play, as far as evaluating the individual, saying, okay, hey, well, this is the type of ataxia that we're dealing with, and this is the best way to treat that. And then here are some ways that we can maybe fill the gap as far from a safety perspective, whether that be use of assistive devices or bracing or whatever else that we may need to just prevent an adverse event such as a fall, which would just only further decline, or would put that person at more of a, I guess, in a hard spot, in the sense that now they're dealing with ataxia and a fall. So
sure. Well, thanks for answering those questions, Dr. Jeremy. And so we're going to move towards wrapping up here, but I tell you, I've got a bunch more questions. We're going to have you back on, because I'd like to hear a little bit more specifically about what you think about and how you use exerbotics in your physical therapy protocols. I'd love to understand your perspective on the benefits of eccentric training.
Oh boy.
I'd love for people and for me to have an opportunity to ask you more about specifically different joints, different injuries, and even joints, and how the muscles help those joints function better, or help people feel better, specifically in the hip, the back, the knee, the shoulder. How does strengthening actually make those joints function better? I have a feeling you've got some perspective on that. I want to talk to you about, I've just got this question I've had for a long. Why do muscles and connective tissue feel so good, so much better right after strength training, which seems kind of counterintuitive?
Right.
But I noticed that way back in college, when I had tendonitis in my elbow, before every baseball game, I'd go into the weight room and do tricep extensions, and in my elbow, it was like I got a shot in my elbow or something. It didn't hurt. I want to understand why this analgesic effect from loading my muscles, but we can't get into all that today. I'd love to hear more about another success story. So maybe we've got our time together laid out already for next time. And
That
then,
sounds like
but I want to conclude though, just with this. Now it's kind of a broad question, so I need like your top couple points. Just
okay.
What are your thoughts? As an expert, as a medical professional, what are your thoughts on what makes strengthening maximally effective? How do you make strength training as effective as possible?
Oh boy, that is a whoa. I'll try and keep this short. Okay, so how do you make strength training maximally effective?
Is there one principle?
Oh, well, I would say that if I had to nail it down, I would say you have to load it's based on intensity. I would say intensity is something that it has to be taken into consideration.
Okay.
I think that when you think of strength training and how to make it maximally effective, people tend to think of strength training in the sense that I get it all the time. I don't want to look like Arnold Schwarzenegger. Well, if you could look like Arnold Schwarzenegger, you probably would look at least somewhat similar to him. So I think that people need to think of, when they think of strength training, don't think of this and thinking of just, bodybuilders. That's not the purpose of strength training in and of itself. Strength training in and of itself. Now, yes, obviously strength training is one way that somebody can look like a bodybuilder, but I would say more of, think of it from a perspective of you are loading your muscles so that your overall quality of life can be influenced and can be improved, not necessarily just for the aesthetic or for the impact, the idea of being a gym rat, so to speak. I would say from a principle of how you strength train, that the intensity becomes the primary question to answer first, in the sense of you may be doing quote unquote strength training at an intensity that is not really going to influence your strength.
Okay. So you can kind of go through the motions. You can be active without really activating significant whole body benefits.
Correct.
So it sounds like your answer is intensity is the key to making strength training maximally effective. And then of course we want to keep that in balance with then how do we strength train intensely and do that safely and as efficiently as possible, for people. But we will keep that in mind. It's about intensity. It's about working those muscles hard enough to actually trigger change. I love that. So, well, thank you so much, Dr. Jeremy, for being on today and sharing your experience and perspective. And like I said, we're going to have you back on again. And thanks for all that work that you do out there with people every day to help them overcome their barriers and to make a difference in their lives. It's just amazing work you must be very proud of. And so I also want to share with everybody, I'll be back on Tuesday night, 7 p.m. Central. And I'm going to talk about your bathroom scale. I'm going to be talking about how to turn your bathroom scale into a super wellness tool. How to use that, how to understand what that scale is showing you, and how to use it in ways that can actually help you be more motivated, get better results, and certainly avoid some of the confusion and even frustration that can come from the darn scale. So I'm looking forward to that Tuesday night, 7:00 p.m. Central. And other than that, thanks again, Dr. Jeremy, and all of you. Have a great weekend. Stay safe. Be well. Talk to you soon. Bye-bye.
All right. Thanks for having me.
You're welcome. Thank you.